Hi, I'm Dr. Dan Sindelar. You know, I remember back when I thought my practice would have more production because I didn't make people pay for it right away. And I couldn't have been more wrong. Your revenues and your production will skyrocket once you incorporate payment plans and payment options. It amazes me to this day, but quite a few years back, we initiated a prepayment plan where patients were given a discount if they paid before service, or we had options during the day of service where it was credit cards, cash, or third-party payment plans where they can go through some of the finance companies that we all can access. And the end result was most of ours prepaid. I was amazed. We had probably 75 to 80% of our care prepaid 2 to 4 weeks before they even came in for their work. What a wonderful, wonderful situation in a dental practice. Number one, it eliminates that burden of that visit. They're coming in for care in my office and they've already taken care of it. It's completely off their back. It's off our back. We don't have to worry about it. And actually, the acceptance of care skyrocketed. Our treatment plan acceptance was up to, I believe, 90% 1 month. That's fantastic. And here, we're having them prepay before they even came into the office. Unbelievable. I remember a couple of times I'd see somebody come back up the walk in front of our office and after their hygiene visit, and I thought, boy, what's wrong? Did we forget something? Did they leave something at the office? They're coming back to pay. Put somebody in charge of the options, make sure it's real methodical and step by step, and you'll find that it actually increases your overall revenues and your overall production, and it's quite a boom to your practice. The position of the expert in payment options needs to have good people skills. It's not about number crunching as much as it is about being able to carry on a real good conversation. They really need to understand the problems that patients are faced with these days. We have patients that really need care, but they have some struggles in their life. So find that person that doesn't mind having a conversation, is willing to stand tall and present things, but also fit that into the lifestyle of the person that they're talking with. And that's how I would approach it. That's a very key portion of your practice. And it's not the one that's going to strong arm somebody, it's someone that's going to carry on the conversation. By incorporating payment options in your office and have a real set plan, you're going to find that your practice isn't going to go down by asking people for those to be taken care of. You're going to find out it's going to boom your practice. Just follow the steps. If you want any extra help on that, look into our website at drdansindelar.com.